But so now, without much further ado, we will begin with our first session, where Professor Mauricio Avendano will speak to us about social policy and mental health. And this talk will focus on the different ways through which social policies, such as policies on education, income support, and employment, have the potential to influence mental health. So using examples from both natural experiments and randomized control trials of social programs, the session will assess the claim that social policies can act as both enablers of mental health by acting on the social determinants of health in positive ways, but that they may also inadvertently increase the risk of mental illness by affecting people's lives in ways that are difficult to anticipate. Mauricio Avendano is Professor of Public Health and Global Health and Head of the Department of Global Health and Social Medicine here at King's. He is also Adjunct Associate Professor at Harvard University and faculty member at the Harvard Center for Population and Development Studies. His research examines from various angles how public policies, social transformation, and health systems contribute to health inequalities between and within countries. So Mauricio, the floor is yours. Thank you.
Thank you very much, Hannah. I'm really delighted to be here. I'm very pleased to see so many of you attending this event. It's really amazing to see all the words that come out in the cloud, and I'm really looking forward to this session and to having a fruitful discussion with you. I'm going to share my screen. Hopefully you can see it now. Let me start by saying that I am a social epidemiologist with an interest in public policy, and much of what I'm going to show you really comes out of work that I've been doing with colleagues in King's and around the world, trying to understand how social policies and mental health are connected. I'm going to use a little bit of numbers, so I hope you don't get too desperate about that, but I'll try to focus on the key messages and look forward to any questions you may have. Let me start by evoking a concept that I'm sure it's very familiar to all of you, the social determinants of health. When we think about the social determinants of health, for example, in the context of the WHO Commission on the Social Determinants, we always refer to them as the structural roots of health inequalities. And when we think about inequalities, we're thinking about systematic inequalities by factors like education and ethnicity and race. But what we really sort of have trouble sometimes understanding is that many of those dimensions are critically influenced by aspects of social policy that essentially lie outside of the mental health system and the healthcare system. Taxation, housing markets, urban planning, government regulation, and any aspect of people's lives have the potential to affect education, income, the distribution of these resources, and therefore the social determinants of health. Now, one way to think about this in the context of the UK is to think about how does the UK government actually spend its resources. And this is a graph that shows you the government expending in the UK for a recent year. And what you see here is that from all the expenditure that we have for health, actually from total expenditure, health itself is only a very small part of all the other policies that have the potential to influence both physical and mental health. Education and transportation, housing and the environment, and very importantly, social protection. So basically what I'm trying to, what I'm going to try to argue or try to propose here is that many of the policies that fall outside of health and expenditures in those areas have the potential to transform people's mental health. Now, how do social policies, or why do social policies influence mental health? Now, the first thing to think about is that social policies influence the social determinants directly. Policies that determine at which age we enter the education systems, policies that determine to which school we are entitled to go, poverty reduction policies, social housing, but also private housing, early childhood policies. These are policies that are critical potential determinants of mental health. Now, one might be tempted to think that it's all a matter of how much resources and generosity of the welfare system exists. But what I'm trying to argue here is that thinking about the design of social policies and the policies that governments enact It's really critical because they affect our life decisions and might affect mental health in ways that we didn't always anticipate it, or that the government didn't anticipate. And these social programs may perhaps sometimes help to reduce mental health inequalities, but sometimes they may also contribute to exacerbate or increase mental health inequalities. Governments enact social policies often not with the purpose of influencing mental health. Education policies, poverty reduction policies, labor protection policies, these are policies that have outcomes other than mental health. And they are usually well-intended, but at times these policies can harm the beneficiaries of those policies. For example, policy reforms that have reduced unemployment benefits may have some positive effects. They may reduce unemployment direction, but they also increase anxiety. Policies may thus have effects on social outcomes, but also at the same time have unintended negative effects on mental health. And so therefore, I think what's really important is that we need to develop and build up the evidence to try to understand how the actions of government in different areas outside of mental health policy can have implications for the mental well-being of people of all ages. So what I'm going to try to do in this talk, or in the remainder of this talk, is to go through 3 different examples that we have studied at King's to try to understand how policies outside of the mental health system can have implications for mental health. And I'm going to start with focusing on pension reform. Then I'm going to use an example from changes in education policy. And given the current situation, I'm going to show you some preliminary results from some work that we've been doing in relation to the UK government response to COVID-19. So let me start with the first example. Now, we're all aware that aging populations poses a challenge to the UK and to countries around the world. And one of those challenges relate to the pension system and their sustainability. In response, many countries, including the UK, have demanded from older people that they extend their working careers by raising the state pension age. What you see in this graph is basically what the government in the UK, through a series of different reforms starting in the 1990s, did to increase state pension age, the age at which you can claim your pension. And you can see here in this graph that if you were born around 1950, you could claim your pension around the age of 60. But then if you were born a couple of years later, you actually could claim your pension only 3 years later. And this is a policy that has continued and that has as a purpose the well-intended objective, if you like, of creating an incentive for older people to work longer. Now, this policy, has many motivations in the financial sustainability of pension systems, but it has also led to much reactions and backlash from many different actors in society that consider this a potential injustice or a potential, a potential policy that can harm the well-being of a particular cohort of older women today, but also of women in the future. So together with Ludovico Carino and Karen Glaser, we were interested to understand how does this policy that basically creates an incentive for older women to work longer impacts on their mental health. And essentially what we did, very briefly to explain it to you in a way that I hope is not too complicated, we compared 3 different types of women. I'm just using these pictures to illustrate 3 different types of women. We take these three different cohorts of women who were born at different times, but not too far from each other. For example, Meryl Streep was born in 1949, and according to the law in the UK, she would be entitled to retire at the age of 60. But Isabelle Huppert was born a couple of years later, and she could only retire at the age of 63. Now, if you look at the last example, somebody born in 1956 could only expect to retire at the age of 66. So this means that women who have relatively the same age ended up having very different entitlements as to when they could claim their pension. And what we did was try to ask the question, how does mental health compares across these different women who just differ slightly in their age, but have very different entitlements to their pensions. And this graph is an illustration of the main results and illustrate the impact of the increase in the state pension age on the mental health of women at ages 60 to 64, using data from a large survey in the UK called the Understanding Society, which has some very rough measures of depression and mental well-being. And what it shows you is that essentially women who find themselves basically below the state pension age, so they are required to work longer, and this is the light blue line here for this particular example here, they ended up having higher rates of depression. So being under the state pension age as a result of this reform led to an increase in the probability of depressive symptoms. And this was true for different cohorts and for different measures of mental health. So what this suggests is that a policy that in a way was well-intentioned by encouraging women to work longer did actually succeed in increasing women's employment, but actually had the negative effect of increasing their rates of depression and mental health problems. In this graph, what I'm trying to illustrate is how these effects were different for different kinds of women in different kinds of occupations and types of job. And what it shows you is that essentially it was women who were in jobs that were relatively that had very high demands and that involved relatively lower levels of skills. And it was these women particularly who suffered an increase in the prevalence of depressive symptoms as a result of this reform. So in a way, this reform that was not meant to harm or to benefit mental health had the unintended consequence that it increased mental health inequalities between women from different occupations. Now, this is an example that tells us how a policy that affects older people can have impacts on their mental health. I would like to now go to a different example, which looks at the impact of education policy by looking at the impact of a very old policy in the UK that is called compulsory schooling laws. And we were interested about the impact of a reform in 1972 that essentially raised the minimum school leaving age from 15 to 16 in Great Britain. Now, you may wonder, why are we interested in a policy that happened so long ago? One of the reasons for this is that recently there have also been increases in the amount of years children are required to stay in school, but also because this policy had an impact on cohorts of men and women who are now reaching middle and older age. So we were interested to understand the long-term impact of having been required to stay longer at school. So together with Bahe Nafilian, who led this paper, and Augustin de Coulon at the Business School, we wrote this paper trying to understand whether going longer to school potentially improves your mental health. And you can imagine many reasons why a policy that encourages, especially those from socially disadvantaged backgrounds, to go longer to school may translate on mental health benefits because it might increase their employment opportunities, their earnings, and may lead to improvements in mental health. So I'm going to show you just a couple of slides summarizing the results. This graph shows you the result of an analysis that we did with the UK Labour Force Survey to illustrate the fact that this reform led to an increase in the proportion of young people at the time who ended up staying at school until the age of 16. This is what you see here in this discontinuity by comparing those who were not eligible to the policy because they were too old and those who were eligible to the policy. So the policy was successful in a way to encourage young people to stay longer in school, or by requiring them to do so. Now, this graph shows you now what does this mean for their mental health a couple of decades later. And what's quite surprising in this study is that instead of finding that longer education led to better mental health, what we found is that those cohorts that went longer to school ended up having higher mental health problems than those who actually went shorter to school as a result of this reform. This was true whether we're looking at the probability of having a mental health condition diagnosed, or where we look at, for example, general health questionnaire scores. So this was an unexpected finding in which we find that a policy that in some ways forced young people to stay longer at the school in the 70s ended up having impacts that were negative on their mental health. And again, we don't have a good explanation for this, but this tell us something about the potential unintended consequences of policies. One potential explanation is that research suggests that these reforms actually raise the aspirations of young people, but it actually had no impact on their school achievements, and it had weak or no impacts on their earnings later on. Another explanation is that this is a policy that basically forces, is a mandatory constraint for young people to stay longer at school. And it is possible that not everyone might benefit from such mandatory constraints with potential consequences for their mental health. These are just speculative explanations, but just to illustrate this idea that policies can have sometimes negative effects on mental health. Now, let me come to the last example in which I would like to move to our current kind of situation by trying to show you some results from some work that we've done trying to ask the question of how the UK government response to COVID-19 has or may have had an impact on people's mental health. Now, the reason why we come to this question is because obviously, needless to say, COVID-19 has led to a sharp increase in decrease in economic activity, which has translated in job losses, an economic decline, which we know from previous studies may have consequences for mental health, particularly for depression, anxiety, and suicide. Now, there have been some studies that have looked at this, but the question that we were really interested in is to what extent the social protection mechanisms that the UK government put in place may have contributed to perhaps prevent or exacerbate the decline in mental health or mental well-being that occurs in these periods of economic downturns. And it's quite, despite all the critique that one might have on the particular government response, there's been some research, especially by the IFS, suggesting that government support schemes, and particularly the furlough scheme, actually prevented many cases of unemployment. Without the furlough scheme, it is estimated that around 9.5 million would have lost their jobs. But the actual number was actually 300,000 during the period of the first lockdown in the UK. So we wanted to see to what extent this huge policy, which has actually very little precedent, contributed to a different picture of mental health than otherwise would have occurred in the absence of that policy. So what we did is that we collected in July last year and data through the YouGov omnibus surveys among adults aged 18 years and older. And this was a survey for more than 4,000 adults. And we measured changes in employment, income, and working hours that happened between before the lockdown in February last year and June, so the period in the post-lockdown. And we use sort of measures that are very imperfect, but that give us a sense of potential changes in mental health. We use the GAD scale for measuring anxiety and the PHQ depression scale. So I'm going to show you just a couple of graphs to give you a picture of what we've been able to observe with this data. Now, the first thing that I want to show you is that we're taking here a sample of people who were employed in February and trying to look at what happened to their employment by June. And what you see here is in the blue line is the proportion of people in different levels of income that experience either a change through the furlough scheme or to a transition to unemployment. And what you see here is that those with the lowest income in February actually were more likely to either go into the furlough scheme or experience unemployment than those in the higher income groups. But overall, there was quite a large set of transitions in employment. This is no surprise, and you would all know or have experienced this yourself. We had a large change in employment during this period. Now, this graph shows you the change in income that occur for different workers depending on how much their working hours and working status change. And what this graph shows you is essentially that those who experience no change in their employment or an increase in their working hours experience no change in their income, but actually those who experience a small decrease experience a decline in income. Now, the most interesting here is that, of course, those who experience a period of unemployment or a period of self-employment with no work experience the largest drop in income among all who were affected by the COVID-19 lockdown last year from February to March. This slide illustrates sort of the key, one of the key findings that I want to sort of show you, which is to what extent these transitions or changes in employment and working hours are associated with mental health. And what this shows you is essentially that, you know, workers that either had an increase or no change in their hours, or a small decrease or a large decrease, they actually experienced no increase in anxiety. But it was really those who experienced unemployment or transited to self-employment with no work who experienced a large increase in anxiety. And we see a very similar pattern for the probability of experiencing severe depressive symptoms. So actually, for most of the population that had a change in the working patterns, we found no real evidence of a change in mental health outcomes as measured by these scales, but it was really those who lost their job and that transited to self-employment without work. And we try to understand what might be behind this effect. And we look at the impact of these transitions on two outcomes. One of them is in the ability of these households to make ends meet. And then what this shows you is that indeed, and this is not surprising, those who experience unemployment experience much harsher economic constraints and an increased ability and decreased ability to make ends meet. But also we find that those who became unemployed also had less certainty about the future and their financial status. So there was something about the perception that they had about the future that also changed. Now, I want to show you now another set of results that shows us then the key question that we're asking, which is how the participation in the furlough scheme related to depressive symptoms over this period. And essentially what we find is, again, that those workers who remain in work or those who were in the furlough scheme during these periods actually experience no increase in their mental, in their anxiety or depression symptoms. But it was really those who experienced unemployment or self-employment without work. And the same was true for anxiety and depression. So essentially what this suggests, the way that one could interpret this is that if those who went into the furlough scheme would have actually been in the unemployment group in the absence of any government support, we would have seen a much larger increase in anxiety and depression than the one that we observe in the population. So in some ways, we need to look further into this, but what this sort of tends to suggest is that a program of social protection offer many workers the possibility to remain employed, and that this did not only have impacts on their earnings, but also potentially large implications for their mental health as measured by depressive symptoms and anxiety. And again, just before ending, what we see is that much of that had to do with the impact of the furlough scheme on confidence on the financial future of this household. So even though those who were furloughed had a decrease in the confidence about the future, those who experienced unemployment had a much lower level of confidence around their financial future. So in a way, this program probably did not only impact their income itself, but also influenced the perception that they had of their future, potentially contributing to maintaining a certain level of mental well-being. So I will end here with this conclusion. I hope that this has given you a sense of how social policies can have long-lasting and sometimes unanticipated implications for mental health. And that it really is the way we design these policies, not so much whether they are not only whether they are very generous or less generous, but it's really about how do we design it, what kind of incentives they create, what kind of anxieties they generate. And the way these policies are designed can influence our life choices, but also have long-term implications for our mental health. Hopefully you've seen that many of these social policies particularly influence the mental health of disadvantaged populations, women who had relatively poor jobs in older age, those who were more likely to become unemployed because they were in lower income. So social policy is a critical way through which we can address mental health inequalities. And essentially, this kind of tells us that governments should consider both the negative and the positive mental health consequences when basically looking at the merits of any social policy outside the mental health system. I'll stop here and thank you very much. I'm very happy to take any questions.
Thank you very much, Mauricio. A really wonderful and clear talk, and for me, really emphasizing the extent to which policy can have an impact. And I guess for us and for the conference, the positive from this is that it is possible to design policies, in theory, that can promote and protect people's mental health and well-being. And it may well be that the furlough scheme is an example of that. We do have time for questions. And if you do have any questions, could you please put them into the chat? While people are thinking, I've actually got lots of questions, Mauricio, that came up from that, which I can begin to ask about in the time, if I can take the liberty, if there are no questions coming through from the chat. I guess, in particular, in relation to the first two examples, where there's, it seems like there's quite a long time between the kind of policy and the impact as such. How can we be sure that the change is in fact due to the policies and not to something else?
Thank you very much, Craig. Yeah, that's a really good question. We didn't have a lot of time to go into the details, but what those two studies do is something which we call a natural experiment, through which we try to mimic what we will do in a randomized experiment, in the same kind of way that we, for example, look at the impact of vaccines on outcomes, in which people are randomly allocated to a treatment and control group. We kind of try to do the same, but looking at things that randomly allocated people to the control and treatment group, if you like to call them like that. So for example, the pension reform, it's something that actually it's completely uncorrelated with your own characteristics other than the date of birth, right? So you either were lucky or unlucky in a way to be born just after or before 1950. And this is what generates a kind of level of randomness. Obviously, we use many regression models and control for many different circumstances and other sort of changes that might affect health. That's how we try to do it. And obviously, there are always there's always the possibility that this may be due to something else. But this is kind of the very basic principles of natural experiments and trying to find a kind of an experiment in the real world.
Great, thank you very much, Mauricio. I'm sorry, I jumped in and didn't realize that there's lots of questions actually through the Mentimeter. Verity, I think you're able to share the screen to show that, and maybe we can then pick some questions from that. Well, in which case, I don't know, I assume that you can also see these, Mauricio.
Yes, I can see them. Yeah, thank you.
There's lots of questions.
Maybe you want to pick where we start, Craig, or?
Okay, let's have a look. I guess it isn't one possibility, and it's partly because it's in the front of my screen, but it is the interest around whether there are similar measures in other countries to the furlough scheme in Britain, and is there any research about the impacts of those schemes, and can that tell us something about the impact of the British scheme? And I guess just kind of extrapolating from that, does it kind of all suggest that some form of income support scheme, some kind of universal basic income, for example, is something we should consider as a positive step for mental health?
Yeah, thank you. I'm just reading the questions and they're really super interesting. Thank you, everyone. I think we don't have a lot of evidence yet, and it's probably far too early to say whether these schemes had an impact on people's mental health. I think there is some work looking at different kind of social programs, things like the basic income There are experiments, studies trying to assess the impact of those programs. Now, obviously, all of these programs in response to the COVID-19 pandemic came all of a sudden, and whatever evidence we have is quite observational. Also, what I show you is quite observational. But I think what is important here is not so much to say that the furlough scheme itself was perfect or imperfect. In fact, it probably has many imperfections, but that actually any sort of action that tried to protect people from job loss has the potential to influence mental health. There are some studies going on, for example, now with this package of programs that was launched in the US to try to understand the impacts that it has. So I think we'll know a lot more about it in a couple of months. Yeah.
Thanks very much, Mauricio. And I see that there are some questions also on a universal basic income.
That's right, the universal basic income. Yeah, it's really, really interesting. Yeah, I mean, I think this is a question for a long discussion. The universal basic income has a very clear, rationale, very good reasons to do it, but also there are many different things that could be affected by the universal basic income that we may not anticipate. What kind of impacts might have in employment or educational choices, and things that might end up having, again, unexpected effects on mental health. So, even though I personally really sort of connect with this policy, I think we need to look at really the studies to see what impact it has. Now, you probably all know about the Finnish experiment, for example, in which some of the findings were revised a couple of months ago, and they do find some positive effects on well-being, overall in well-being and also on employment, which didn't show up in the beginning. So again, this illustrates how these policies might actually take quite a while to actually have an impact on people's lives. Many of these effects often are also specific for certain groups and not for other groups. So I think it's quite a complex sort of set of policies. And in any of these social policies, there will always be losers and winners, right? Some will benefit from the policy in some ways, some will lose out in some ways. And sort of these are the kind of trade-offs that, in a way, policymakers have to make. And that's why we need the evidence to know how they influence people's lives.
Thanks very much, Mauricio. I see that there's a huge number of questions actually in the Mentimeter, which is wonderful to see and clearly stimulated by the very, very interesting talk, Mauricio. I guess for the centre, these are the kinds of questions that we hope to be able to pick up in the coming 5-10 years or so. I don't know if we have time for one more question. I have a feeling that we're on quite a tight time constraint. So Laura, if we've got time for, okay, so no, sorry is the response in the chat. So sorry about that. And to those of you who have raised questions, we're sorry that they've not been answered or addressed. I just want to end then by thanking Mauricio for a very stimulating talk, a great way to start the second day of the conference and to continue the discussions that we began yesterday and which will continue through the rest of this afternoon and tomorrow.